My name is Dr. Abha Chikarsal and I'm a general practitioner. I've been in general practice since 2011. Over the years, I've had a mix of experience working in country hospitals, more so they're called urgent care centers, and aged care facilities, apart from the clinic work. I just wanted to treat people. I think I just had this thing in me where I just wanted to pursue medicine. So I've completed the certificate course in dermoscopy through HealthCert, and I've also done a course in minor office procedures through HealthCert that has given me the capability to do skin checks and just to feel confident in doing skin checks and understanding that actually this is a domain every GP should enter, and every GP should have that skill to do basic skin checks. So I get this sense of empowerment on something which is very basic, a very basic part of examination, particularly in the Australian medical system because of the highest rates of skin cancers in Australia and the world. So that's how the certificate course in dermoscopy has helped me. The other course in office procedure has given me the next step to work after I've diagnosed a skin lesion to manage it in a primary care setup instead of sending the patient to a specialist. I feel that a lot of skin cancers can be treated in primary care, and it saves patients from travel and spending a lot more money. It makes it very cost effective for the patient if we have those skills to manage skin cancer in primary care. So the advice I have for doctors who are going into skin cancer is have the knowledge base, just enroll themselves in the right course they're interested in. The knowledge base I gathered and developed through the HealthCert courses really gave me that confidence to then go into the field and start doing the skin checks and the skin procedures. So the advice I have is to have the knowledge base so that you can do things accurately and with confidence. I think one of the difficulties in my job, particularly in management of skin cancer, is patient follow-up. So we need to explain the patients very well about wound management and rest, particularly when we're dealing with situations like halo graft. Explaining the importance of resting and coming back for follow-up as planned is very important, and unfortunately sometimes that doesn't happen. So if the patient is well, they feel that everything's well and they might not follow your instructions. So that's a challenge. And sometimes in aged care facilities, wound dressings and the right time for suture removal and the directions around that, and ensuring that the staff has understood those directions and are able to follow those directions accurately, can be a bit of a challenge. I certainly feel that in primary care, there has to be an increased uptake of knowledge about and upskilling about dermoscopy in particular. I think given that we have the highest rates of skin cancer in the world, every general practitioner, every doctor in primary care should have that knowledge base to be able to diagnose basic skin cancers, pick up basic skin cancers, and do the basic management of those skin cancers. I have a really great team in my clinic where I'm working, and we have a really well spread, a great mix of skills amongst our team members, amongst our doctors, and we have a common break time where we bounce off ideas each other. And we share the difficult patients, difficult scenarios we've encountered in a day. It's amazing to see that when you have an experience, someone else has already had that experience. So it's good to share those ideas, those other people's experiences, and it's comforting to get other people's ideas on the same thing. And it might be, you might gather very beneficial tips and tricks on lots of things, and I've sometimes changed my practice when I've encountered when a more relevant, a better way of managing a certain thing. The most enjoyable aspect of being a doctor truly is that people give us this power to be really close to their lives. They confide in us, they give us this power to help them. I think that's one of the biggest privileges of being a doctor. Uh, One of the most valuable lessons I've learned as a doctor is to not give up. Things can change and things can be better if we just not lose hope. And if we are hopeful as doctors, we give the same hope to our patients.